So hello everyone, welcome back. In today's session we will be studying about vitamins. An accessory but vital nutrient that serves as a coenzyme or cofactor in an essential metabolic process. Vitamins are required by the body in very small amounts. Vitamins do not yield energy, you know, right? Then vitamins A, it is formed from the precursor, that is carotene. Vitamin D formed by the action of ultraviolet light on the skin, and vitamin K, it is formed by the action of bacteria within the intestine. Those are made within the body. Then deficiency of any vitamin cause specific deficiency disease except vitamin E, which deficiency disease is not known. Then three vitamins like provitamin A, that is also called carotene, vitamin C and vitamin E are termed as antioxidant vitamin because they inactivate or remove free radicals from the body. So which all vitamins are antioxidant? That is provitamin A, vitamin C and vitamin E. Now coming to classification. Based on solubility, vitamins are divided into two groups, that are fat soluble vitamin and water soluble vitamin. So what all are the fat soluble vitamin now? That is vitamin A, D, E and K. And water soluble is vitamin B group and C. Now based on response to heat, vitamins again divided into two groups. Heat stable vitamin, that is A, D, E and K, and heat unstable vitamin, that is vitamin C and some vitamin B like thiamine, B1 and folic acid. Okay. Now fat soluble vitamins deficiency mainly occurs in disease that interfere with the digestion of fat, such as steatorrhea. But it can also accumulate in organs like the liver when taken in excess amount. Okay. Then water soluble vitamins are readily lost from the body in urine and sweat. Hope it is clear to all of you. So basically the classification is fat soluble vitamin and water soluble vitamin on the basis of solubility. So fat soluble is vitamin A, D, E and K. Water soluble is vitamin B group and C. Then based on response to heat, that is heat stable vitamin, that is A, D, E, K again. Then heat unstable is vitamin C and some vitamin like thiamine, B1 and folic acid. It is clear? Now one by one we will be discussing in next. Vitamin A, it is also called retinol. It is a fat soluble vitamin formed within the body, liver or intestinal mucosa from carotene, that is yellow pigments of plants, which are also called provitamin A. Liver have enough capacity to store vitamin A to meet needs for 6 to 9 months. Okay, so basically vitamin A is stored in liver, which will be meet needs for 6 to 9 months. Okay, now function. What all are the functions of vitamin A? It is very essential for normal vision. Form visual pigments, example is rhodopsin. Then it is necessary for the normal functioning of glands and epithelial tissue in body. It has anti-infective role in the body, that is increase immune response. So it decreases susceptibility to infection. It may protect against some epithelial cancer also. It increases skeletal growth. So what all are the functions now? It is essential for normal vision. Form visual pigments, example is rhodopsin. Then it is necessary for the normal functioning of glands and epithelial tissues in the body. It has anti-infective role in our body, that will be increasing the immune response. So the disease susceptibility to the infection will be achieved. Okay. Then it may protect against some epithelial cancer also, and it increases skeletal growth. Now coming to what all are the sources of vitamin A. First one is animal foods. That is retinol, vitamin A found only in animal food. Liver, milk, fish, egg, meat, butter, cheese, etc. are richest source of retinol. Then fish, liver oils are richest natural sources of retinol. Okay, because if you have seen some vegetarian also, they are taking fish liver oils, who are especially going to gym. If you have heard, so they are taking fish liver oils for the vitamin A. Now cod liver oil is a type of oil obtained from codfish liver which is rich in vitamins A and D. So animal foods में क्या है देखो, retinol found only in animal food, that is liver, milk, fish, egg, meat, butter, cheese, etc. These are the richest source of retinol. Fish liver oils are richest natural sources of retinol. Cod liver oil is a type of oil obtained from codfish liver which is rich in vitamin A and D. Now plant food. In plant, it found in provitamin A, that is beta carotene form. Okay, retinol form it is only found in the animal food, and in plant it is found in provitamin A, that is beta carotene form. Okay, dark green leafy vegetables, that is spinach, then carrot and some fruit like mango or papaya are rich plant sources of vitamin A. Carotenes are converted into vitamin A in the liver. It is clear? So in plant we are finding it as a provitamin A, that is called beta carotene. In dark vegetables like spinach, carrot, some fruits like mango, papaya, these all are the richest plant source of vitamin A. Carotenes are converted into vitamin A in the liver. Now fortified food. Fortified food with vitamin A can be an important source of vitamin A. Examples like milk and vanaspati ghee. Fine. Now coming to deficiency disease. See, night blindness. Deficiency of vitamin A cause night blindness. It is first clinical symptom. So night blindness is the first clinical symptom and it is because of deficiency of vitamin A. Now next is conjunctival xerosis, that is dryness of conjunctiva, a membrane which covers the eyeball and inner side of eyelids. It is the first clinical sign of vitamin A deficiency. So first one was night blindness, second is conjunctival xerosis. Dryness of conjunctiva, a membrane which is covering the eyeball and inner side of eyelids. It is the first clinical sign of vitamin A deficiency. Next is white or spot. What is white or spot? Triangular, pearly, white or yellowish, foamy spots on conjunctiva on either side of cornea. Corneal xerosis. The cornea become dry and eventually become opaque. It is a serious condition. Okay. Then keratomalacia, that is liquefaction or extremely softening of cornea, called keratomalacia. Then what is keratomalacia? It is liquefaction or extremely softening of the cornea. This is called keratomalacia. It is a grave medical emergency. Now all above ocular manifestation of vitamin A deficiency from night blindness to keratomalacia called xerophthalmia, that is dry eye. Okay, so from dry eye all these manifestations are starting. The most frequent cause of blindness in developed countries are accidents, glaucoma, diabetic retinopathy, hypertensive retinopathy and cataract. Hope it is clear. In Southeast Asia like India, the principal cause of blindness is cataract, responsible for 62.6% of all cases. Then vitamin A deficiency, which is responsible for most of the childhood blindness, now declining slowly. Early stage of xerophthalmia can be reversed by administration of massive dose of 2 lakh international unit. This is important. Or 110 mg retinol permitted orally in 2 successive days. So early stage of xerophthalmia can be reversed by the administration of massive dose of 2 lakh international unit or 110 mg retinol permitted orally on 2 successive days. Is clear? Then child can be immunized against xerophthalmia by administering 2 lakh international unit of vitamin A at 6 months interval from 1 to 6 years of age, and a half dose, that is 1 lakh international unit, between 6 to 12 months. So first 6 months we are giving 2 lakh international unit, and next 6 to 12 months we are giving 1 lakh international unit. What they are saying, that 2 lakh international unit we are giving at 6 months interval from 1 to 6 years of age, and a half dose of 1 lakh international unit between 6 to 12 months. Hope it is clear. Now coming to daily requirement. Daily intake of vitamin A according to ICMR 2010 are: infant it is 350 microgram, preschool age it is, that is 1 to 6 year, 400 microgram, then school age it is 7 to 12 year, adolescent and adult men and women it is 600 microgram, women with lactation 950 microgram, and women with pregnancy it is 800 microgram. And excess intake may cause nausea, vomiting, anorexia, skin discoloration and teratogenic effect. So if you are taking excess amount of vitamin A, it may cause nausea, vomiting, anorexia, skin discoloration and teratogenic effects. Vitamin D, that is also called cholecalciferol. So let's start. There are 2 forms of vitamin D which used by human are calciferol D2 and cholecalciferol, that is D3. Vitamin D itself is metabolically inactive, but it becomes active in the form of calcitriol or 1,25 dihydroxy cholecalciferol into kidney in the presence of parathyroid hormone. So it is also known as kidney hormone. It is also called anti-archaitic vitamin because its deficiency interferes with calcium and phosphorus use, which in turn causes rickets. Now it is oil soluble vitamins, so it stores into fat depots of body. It is clear? So basically vitamin D is a metabolically inactive. It becomes active in the form of calcitriol or dihydroxycholecalciferol into kidney in the presence of parathyroid hormone. That's why it is also called kidney hormone. It is called anti-archaitic vitamin because its deficiency interferes with the calcium and phosphorus use, which in turn cause ricket. And oil soluble vitamin, so it stores in the fat depots of body. It is clear? Now coming to sources. So what are the sources now? That is sunlight, 7-dehydrocholesterol, which is deposited under skin by exposure to ultraviolet rays of sunlight, converted into vitamin D, that is cholecalciferol. So it is also called natural vitamin. Now foods. Vitamin D found only in animal origin. Okay, so vitamin D found only in food of animal origin, like milk or milk products, meat, liver, fatty fish, egg yolk, etc. Fish liver oils are richest sources of vitamin D. It is not found into food of vegetable origin. It is clear? So vitamin D, it is exclusively animal origin, like milk, milk products, meat, liver, fatty fish, egg yolk, etc. Fish liver oils are richest sources of vitamin D. It is not found in vegetable origin. Okay. Then functions of vitamin D. The main function of vitamin D is to increase calcium and phosphorus level in the blood by increasing intestinal absorption and renal tubular reabsorption. It increases mineralization or hardening of the bone. It also lowers risk of many cancers like stomach, colon and breast. Now deficiency, that is rickets. Deficiency of vitamin D usually in young children, that is age 6 months to 2 years, causes rickets. It characterized by bone deformity like curved legs, deformed pelvis, pigeon's chest or chicken breast or pectus carinatum, a condition of chest in which the sternum projects anteriorly due to the rickets. Then due to inadequate mineralization of developing cartilage and newly formed bone, muscular hypotonia, then tetany, intermittent tonic muscular spasm that typically involve the arms or legs due to hypocalcemia. It is clear? See, deficiency of vitamin D usually in young children, the age is between 6 months to 2 years, causes rickets. So how it is characterized? It is characterized by bone deformity like curved legs. We have already seen that bow leg in medical term, that is called bow legged. Then deformed pelvis, pigeon's chest or chicken breast or pectus carinatum, a condition of chest in which the sternum projects anteriorly due to the ricket. Now it is because of inadequate mineralization of developing cartilage and newly formed bone. Muscular hypotonia and tetany both are present in ricket. Now osteomalacia, or it is also called adult rickets. Softening of bone due to vitamin D deficiency in adult called osteomalacia. It is common in women during pregnancy and lactation. It is clear to all of you? It is basically softening of the bone due to the deficiency of vitamin D. Now daily requirement, that is RDA, recommended daily allowance of vitamin D according to ICMR. Adult, it is 2.5 microgram or 100 international unit. Pregnancy and lactation, that is 10 microgram or 400 international unit. Then infants and children, that is 5 microgram or 200 international unit. Hope it is clear. Now we will be discussing about vitamin E, or it is also called tocopherol. So toco means childbirth and phero means to bear. It is essential for normal reproduction in animal and human. Vitamin E widely distributed in foods, so the deficiency of the vitamin E in the general population are rare. Richest source of vitamin E is vegetable oils like cotton seeds, sunflower seeds, egg yolk and butter. Vegetables and fruits are poor sources of vitamin E. Vitamin E is mainly now using for destruction of free radicals from the body. So it is used as an antioxidant. So basically it is widely present in foods. That's why the general population, its deficiency are rare. Okay. So richest source of vitamin E is vegetable oils like cotton seeds, sunflower seeds and egg yolk and butter. Okay. So how it was? It mainly using for the destruction of free radicals. Free radicals means that is causing the cell age. So it is destructing the free radicals. That's why it is also called antioxidants. Okay. Now coming to vitamin K, that is the last one of fat soluble vitamin. So let's see. There are two major forms of vitamin K are K1 and K2. Vitamin K1 mainly found in fresh fruits and green vegetables like dark green vegetables. So vitamin K1, it is found in fresh fruit and green vegetables like dark green vegetable. Okay. Then vitamin K2, it is synthesized by intestinal bacterial flora. So first one, it is found in fresh fruit, green vegetables like dark green vegetable, and vitamin K2, it is synthesized by intestinal bacterial flora. Clear? Now cow milk, that is 60 microgram per liter, is the richest sources of vitamin K. Then human milk, that is 15 microgram per liter. Long-term use of antibiotic may cause suppression of intestinal flora and may cause deficiency of vitamin K. Vitamin K is stored in the liver. So vitamin K, also called an anti-hemorrhagic factor or vitamin. It is essential for production of clotting factor, that is 2, 7, 9 and 10. So it is essential for the production of clotting factor, that is 2, 7, 9, 10. Clear? So in deficiency of vitamin K, clotting time CT and PT, that is prothrombin time, become prolonged. Okay, the newborn infants are deficient in vitamin K due to deficient intestinal bacterial flora and minimal stores of prothrombin because of immature liver at birth. That's why in newborn baby now we are giving vitamin K. So that's why we are giving, because they are having deficient amount of intestinal bacterial flora and minimal stores of prothrombin because of immature liver at birth. So soon after birth, all newborns should give a single intramuscular injection into vastus lateralis muscle of vitamin K3, that is myenadione sodium. So vitamin K3 we are giving, right? A synthetic vitamin that can be converted in the body to active vitamin K, that is 0.1 to 0.2 mg, or vitamin K1, that is phytonadione, 0.5 to 1 mg at birth. Large doses of newborn may lead to anemia and cardiac arrest. So large dose also should not be given to newborn because it may lead to anemia and cardiac arrest. Within the kidney, vitamin K acts to inhibit calcium oxalate stone formation. Clear? So that's all about fat soluble vitamins. In next class we will be discussing about water soluble vitamin. Till now keep revising this one and we will come back soon, and thank you so much for hearing me.